Okay, hello friends, welcome back to my channel Medicine of 101. Today we will talk about perinatal asphyxia. Okay, so let's talk about some basic points regarding this topic. Okay, so whenever you are talking the term perinatal means we can see this type of the problem during the birth, after birth, or before birth. Okay, and what do we mean by asphyxia? Asphyxia means definitely we will see in these cases that the neonates or the individuals over here, they will be unable, there will be inability to initiate the breathing or sustain the breathing. Okay, so let's write it over here. So when can you see this type of the problem? The perinatal means in this way you have to write that occurs during birth, or we can get it before birth, or we can get it in terms of after birth. Okay, and what do you mean by asphyxia? Asphyxia means whenever we will see definitely the blood flow that will be less in these cases, but the most important thing that you need to know that in these cases the individual or the neonates, there will be inability to initiate or sustain breathing, or to sustain breathing. Now see, whenever the neonates or these individuals they are not able to initiate the breathing, what problem you can see, definitely the the oxygen level that will be less within the lungs. From the lungs in the different kinds of the tissues, the oxygen that will go, the amount of the oxygen that will be very less. So see, in this case, if we just see a little bit of the pathophysiology, what we are gonna get over here. Okay, now see, whenever we are seeing inability to initiate or sustain breathing, as a result we will get what? There will be development of definitely the oxygen that will be less, and whenever the oxygen will be less, definitely what? We will see the hypoxia. Okay, and along with that we will also hypercapnia. Hypercapnia. That means the concentration of the carbon dioxide or the partial pressure of the carbon dioxide that will be increased over here. Hypercapnia. Okay. And whatever the problem, whenever we are seeing getting the term hypoxia, definitely see whenever we are getting the term hypoxia, if we just say normally that during the the metabolic process, in the metabolic activities, whenever we are talking in terms of the glycolysis process. Okay, so if oxygen is available, then the pyruvic acid that will go to the TCA cycle, because that will take place within the mitochondria, and for these things oxygen is important. Okay, but whenever oxygen is absent over here, definitely we will see over here the glucose. Okay, that will be converted into what? Lactic acid. And there will be accumulations of the lactic acid too much. Definitely we can consider this thing right now in terms of metabolic acidosis. So we get over here ultimately we will get the metabolic acidosis. And in these cases what we are going to get in terms of the hypercapnia, we will get what? Respiratory acidosis, because more amount of the carbon dioxide will be there, so more amount of the water molecules that will react with each other, they will produce the carbonic acid. After that it will be dissociated, we will get what? Proton plus bicarbonate. So the concentration of this thing that will be increased too much. Okay, so we can see also these things that we will get also the respiratory acidosis. Okay, respiratory whenever you are getting this type of thing, this can cause the multiple organ failure, or you can say multiple organ dysfunction. As a result, we will get what? Multiple organ dysfunction. Multiple organ dysfunction. Or the most important organ that is known as that is the brain, especially. See, just listen it very carefully, okay? Especially if we talk about in terms of the brain, whatever the problem we will see in this case is, see, our brain needs always oxygen. There should be always supplementations of the oxygen within the brain, okay? Now, so whenever we are getting the hypoxia, definitely the oxygen within the brain that will be supplied less. Okay, now whenever we will get this type of the thing, What type of the clinical manifestations we will get over here? So let's write it over here. So whenever at the brain level, the oxygen will be severely less, the decrease in these cases. So in these cases, we will see there will be development of hypoxic ischemic encephalopathy. So whenever we will see that the oxygen level or the concentration of the oxygen, so the supplementations of the oxygen within the brain, that will be severely decreased, that will lead to the formation of hypoxic ischemic encephalopathy. Okay, so let's write it over here. Hypoxic ischemic encephalopathy. This type of the problem will get over here. And whenever we will get this type of the problem, then where the most chances for the brain to get affected for these things. So the parts of the brain that will be involved over here, the most common part, rather you can say the most common part that will be involved in these cases. Okay. Now we can divide this HIA. We can classify in terms of the term baby and preterm baby. In case of the term baby, we'll get parasagittal. We'll get the parasagittal. In these cases, we'll get this type of the problem. I mean, in terms of quadriplegia, we'll get parasagittal quadriplegia. In these cases, we'll get this is one kind of the cerebral palsy. So we'll say in terms of the what? Then the sagittal sections, the parasagittal sections will get the quadriplegia. This is one kind of what? The cerebral palsy. Okay. Now this is all about in terms of in case of the terms baby. What type of the problem we see in terms of the preterm baby. That's also important to know over here. Okay. Now let's write it over here. In case of preterm baby, okay, the most common part that will be affected in terms of the hypoxic ischemic encephalopathy, that is the periventricular area. Periventricular areas. That means if it is supposed to be the first, the two lateral ventricles, and if it is supposed to be the third ventricle, then in these cases we will see the most chances for this thing, these regions they will be affected, the periventricular regions. Okay, periventricular areas, and in these cases we will get the development of. In these cases we will get the development of leukomalacia. That means we'll get white. Leuco means white. Malacia means we'll get the soft. We'll get the white matter over here that will be soft over here. Okay, in these cases. So this is all about in terms of the HI. Okay, we'll get the hypoxic ischemic encephalopathy. We can get in terms of the term baby. We can get in terms of the preterm baby. In case of the term baby, we'll get the parasagittal quadriplegia. There is one kind of the cerebral palsy. We'll get this different kinds of the problem. Okay, here one kind of the paralysis we can see over here. In the same way, we can also get in terms of the preterm baby. Okay, that will cause the effect in terms of the periventricular areas. And in these cases, we'll get what? We can get leukomalacia. That will on top of the white softening on the white. Leucom is white. And malacia means we'll get within the white matter that will be soft. Okay, that will be soft over here. Now we'll talk about in terms of the various kinds of Let's write it over here. Okay. One more thing, we can write it over here. I had to mention this one. Yeah, we can write it over here that diplegia. Let me write it over here. Diplegia. Spastic diplegia. We'll get it over here. Okay. Now we need to know some of the criteria by which. So let me write it over here. The diagnostic criteria for severe birth asphyxia. So let's write it over here. So diagnostic criteria. Okay, let's see over here. Diagnostic criteria for severe birth asphyxia. Okay, now how can we just diagnose these things? So there are certain kinds of the things, because already have mentioned that we will get the multiple organ dysfunctions. So let's know few of them. Okay. Now at first we need to know what type of the problem we will see at the CNS level. At the CNS level we will get this type of the problem. I mean in terms of the hypoxic, in ischemic encephalopathy. In these cases we will get the seizures. We can get the seizures. Then we will get the tone abnormalities. Tone abnormalities. We will get the hypotonia, this kind of the thing. I'll talk about all these things in the subsequent parts. I mean within a couple of minutes over here. Okay. Now if we just talk about over here that, okay, at the renal level. So whenever we see the oxygen level will be less over here, in these cases we can get the acute tubular necrosis. Acute tubular necrosis. The third level, whatever the problem we can get at the GI level, GIT, in these cases we can get the hypoglycemia. We can get, the acidosis. Okay. In terms of the hematological aspects, whatever the problem we can get, in these cases we can get the thrombocytopenia. Okay. There are much more things, I'm not going in details all of them. Thrombocytopenia we can get over here, or sometimes you can see the the coagulations problem. Abnormal coagulations, it's better to write. Abnormal coagulation. Okay. And what kind of the problem we can get in terms of the heart? In case of the heart, we know that there will be a problem because the myocardium needs oxygen. The myocardium needs oxygen for its muscular contractions. But whenever we will get the deficiency of the oxygen here, then what? We will get the myocardial dysfunction. Myocardial dysfunctions. Okay. So for this thing, we can get the different types of problem. We can get the arrhythmia. Okay. For example, arrhythmia. Then we can get the problem in terms of the in terms of respiratory aspects. So let's write it over here. We can get in these cases pulmonary hypertension. We can get the pulmonary hypertension over here. Okay. So these are the diagnostic criteria for the severe birth asphyxia. There are also much more, but I didn't mention all of them. So these are the more few important points you can remember over here. Now we'll talk about what we have to classify in terms of the HI. That means we'll just talk right now about the HI, hypoxic ischemic encephalopathy. It is having the different kinds of stages: stage 1, stage 2, stage 3. Okay, where we'll just talk about in details all of the stages. So let's talk about the stages of the HI. Okay. Okay, let's erase this part and let me make it easier. Okay, and it will be easier to see the board. Now we're going to talk about the different kinds of the stages of HIE. Now, stages of HIE. Okay. Now first we'll write it over here. There's the parameter. About which parameter we are comparing in among the different kinds of the stages of HIE. The first, stage 1. That is known as mild stage also. Stage 2 is moderate. And we will also get the stage 3. It is severe. Okay. Now we'll classify. First, we'll talk about in terms of the HIE. Okay, let's make it. Okay, let's put a cover on it. Okay. Now, first we'll talk about level of consciousness. Level of consciousness. So level of consciousness in these cases we will get, in these cases If we see the individuals of the neonates under the what, the stage 1, in case of the mild, in this case we will get the individual that will be hyper alert, and we will also get the irritability of the, like one kind of the irritations we can see within the individual. Irritability, okay. And in these cases we will get the level of consciousness that will be from normal to depressed. That means it will first will see the normal, ultimately as time passes by we can get also the depressions. Normal to depressed over here. And in stage 3 there will be comatized. There will be no response. Okay, we will see the level of consciousness that will be lost over here, we can say. That's why I'm just highlighting with these things that will be comatized. The first thing, level of consciousness, okay. Now we'll talk about the second parameter over here during the tone. Okay, let's write it over here. Tone. In these cases, we will see the muscular tone that will be normal over here. In these cases, we will get hypotonia. As I already said, we will get the quadriplegia, we will get diplegia. Okay, that means what? We will get over here, there will be problem at the tone level, tone abnormalities. Okay, and in these cases, we will get the severe hypotonia. We will get severe hypotonia. First, we will get the normal, then the second, we will get the what? Normal, I mean, in terms of the mild hypotonia, we can say. Okay. Now we'll talk about the third important one, autonomic nervous system. Whatever thing we'll see in these cases. Okay, so first we'll talk about the first thing. Okay, so whatever the problem we'll see in terms of this stage, when you will see this stage 1 HIE in terms of the hypoxic ischemic encephalopathy. So when we are talking the autonomic nervous system, in these cases we'll get the activation of sympathetic system. As a result, we will get what in this case is the heart rate that will be increased definitely, and we will get, if we see the pupil, we will get definitely what, dilations of the pupil. So we will get mydriasis. And what about in these cases? In these cases, we will get activations of the parasympathetic system. So activation of parasympathetic nervous system. Okay, right. And in these cases we will get heart rate that will be decreased, and instead of mydriasis, or we will get the pupillary constrictions. So that is known as meiosis. That will be what, pupillary constrictions. Okay, and whatever the problem will say the third level in the stage 3, here we will see the both. There will be inhibition of both. I mean, in terms of the sympathetic nervous system, we will get also the parasympathetic nervous system, both will be inhibited. So whenever we will get the both inhibitions of the both systems in terms of the autonomic nervous system, here we will get the heart rate that will be variable. Sometimes it will increase, sometimes it will decrease. And in terms of the people, we will get over here that mydriasis. Okay, in these cases we will understand the problem. Now I have already talked about in terms of the level of consciousness, in terms of the tone, in terms of the autonomic nervous systems. Okay, now let's talk about some more points here in terms of seizures and Morose reflex. Okay, let's put in number 4. So if I say in terms of the seizure, that will be absent over here, that will be present over here, and that will be absent. In the severe cases, we will see the also absence of the seizures in these cases. And in Morose reflex, let's write it over here. Morose reflex. What we are going to get over here? Morose reflex will get absent, okay, and we will also get present. That means in these cases we will get exaggerated, that will be increased over here. In these cases we will get normal to depressed. Okay, And in the third case, we'll get what? Absence over here. Will be absent. Now these are all about, in terms of the perinatal asphyxia. Okay, now we'll talk about the management. How can we just do the management of these things? Now let's talk about the management over here. Okay, so how can we do the management? Okay, now see, in terms of the management, the first thing, that is the most important thing over here, there is a supportive care. There is a supportive care. That means whenever we are just sending the individuals in the units intensive care unit over here, after just getting over here, whatever the thing we have to do, first we have to use the intravenous fluid. Then we have to make sure that the normal glucose level. Okay. Then you have to make sure that normal temperature. And whenever we are talking in terms of the, for example, the hypoxic ischemic encephalopathy, in these cases, we have to monitor the brain activity. So for monitoring brain activity, okay, whatever thing we can use over here, along the bedside, we can use, okay, let's write it over here, AEEG. What can you use? We can use amplitude integrated, okay, electroencephalography. You can use these things. Then you can monitor the whatever the activities are going on within the brain. So maybe sometimes you will get, for the whenever the seizure will come again, it will come back to the normal in this, so you can get, okay. So we can use this type of thing in terms of the supportive care. Now whatever the drug we can use in terms of, if we get any type of the seizures, symptoms over here, what types of the drugs we can use, what do you think? Okay, let's use one more space over here. What can I use over here? Okay, let's write it over here. Now whenever we are talking in terms of the drugs, if we get the neonatal seizure, then the drug of choice in case of the neonatal seizure, that will be definitely the phenobarbital. Okay, so the phenobarbital, okay, that will be the drug of choice. And the most common type of the seizure, whatever the seizure we will get in these cases. And another thing I have to know over here, that most common risk, I mean in terms of, let me use this one. Okay, see, most common cause. So the most common cause, that will be what? Hypoxia. The most common type of the seizure, that is subtle seizure. Okay. Now see, let's repeat once again that whenever we are talking in terms of the neonatal seizures, whenever we are talking in terms of the neonatal seizure, the drug of choice in these cases, that will be the phenobarbital. What is the most common cause for developing the neonatal seizure? Definitely we have to know in terms of the hypoxia. Okay, for the hypoxia we got over here, we got only here the hypoxic ischemic encephalopathy. Okay, as a result, ultimately we got the neonatal seizures, and we can use the phenobarbital. The most common type of the seizure, that will be subtle seizures over here. So that's all in terms of the perinatal asphyxia. We have already classified in the different kinds of stages. We have classified in terms of the management. We also said the pathophysiology of it. Okay, so if you think this video is helpful for you guys, please do like and subscribe my channels. See you in the next video soon with the new things.